today's presentations, a major topic is what else vitamins can do for the patients. Because as a world of consumer health care, we look quite a lot on healthy people, and of course here the multivitamin pill is a pill for the healthy people. And that's the question, if vitamins can make the difference in the therapies. Because eventually patient is someone who visits pharmacy on a daily basis. These people drink chronic medicines, and today we know that's a very new evidence how chronic medicines can change the status of your vitamins, how chronic medicines can change your microbiota. And this is why we raised this question on if there is more in the vitamins for patients, and basically we talked about such a patient groups like diabetics. We talk about patients after the stroke for whom 1 year is very important part to bring back all these cognitive functions, and what is the difference that vitamins can do there. We talk about burnout, we talked about air pollution that is quite relevant, and here it's the big question, who is the patient? So this is what we talk about, if vitamins can make the difference in the therapies. What we aim to have as a key learning point is to trigger pharma industry, to come ahead with the novel solutions that are quite easy, but to look at the vitamins from the other perspective. Is there any other vitamin pill that can we bring to the market? If we can combine vitamins with the prescribed medicines, if we can recommend as a pharmacist, if I know that the patient is drinking a certain medicine that is decreasing the level of this vitamin, how should I recommend this? So the aim is to trigger the pharmaceutical industry to innovate inside the pill, to look at the new efficacies of the vitamins and how do they translate it into the patients. The highlights to see from the event of the Nicholas Hall, every year you see the dynamic. And every year you see the change in this consumer health care. So it was quite relevant for me to see yesterday's presentation on pharmaceutical chains and how important is the training of the pharmacist as the care point versus the sale point. So I like that quite very much. That was the major highlight, and also the channels how we look on our patients. And an important thing is that tomorrow's patient, these are quite rational people who wants the science behind, who wants the explanations. So besides the branding, and our consumer healthcare industry is, let's say, spoiled by branding, it is blessed by branding. But at the same time, there is so much more attributes that we can explain and transfer and say, okay, this is rational. And today's patient and consumer is already empowered. They want more, they want to know more, they want to understand why. And let's see on the channels how we are capable to transfer this knowledge and strengthen the brand with the real features to transfer the values. Last year I was the first one on European conference of the Nicholas Hall, and for those who never visited this conference, the most important part of Nicholas Hall event is not what happens during these 2 days, but what happens after these 2 days. Because first of all, you get the great presentations, insights, the data with industry leaders. And it triggers your mind. It makes you to come back to your company and change something and do more. This is the first thing. Second thing is networking. You have a chance to meet those people. And I think like with us for DSM, we meet with our customers. There are ideas that are generated right here, and then we go ahead with the projects. Of course, physically, that's the place to meet with people. And of course, to keep updated.